Welcome to Crazy Nurse RN Hub, where learning becomes a tradition. Come, join me as we explore the multifaceted world of nursing. Hi there, students, and welcome to Crazy Nurse RN Hub, where learning becomes a tradition. My name is Crystal Merducanes, nurse educator, teaching medical and surgical nursing. As continuation to our topic, gas exchange and respiratory function, we have respiratory care modalities. The choice of modality is based on the oxygenation disorder and whether there is a problem with gas, ventilation, diffusion, or both. When we say modalities, these are possible treatments for patients who are experiencing oxygenation disorders or problems. So as an overview, I am showing you the respiratory system, the structures involved in this system. Now let's proceed to the non-invasive respiratory therapies. First, we have your oxygen therapy. Second, incentive spirometry. Third, we have your small volume nebulizer therapy. Fourth, we have your chest physiotherapy. Now let's have your oxygen therapy. It is the administration of oxygen at a concentration greater than found in the environment atmosphere. It provides adequate transport of oxygen in the blood while decreasing the work of breathing and reducing stress on the myocardium. That means we administer oxygen to patients because we want to decrease the work of breathing of our patient and also to reduce workload or stress on the heart's activity. The oxygen concentration at room air is 21%. So for the normal adult who doesn't have any oxygenation problem, the concentration of oxygen that he or she can get from the environment is 21%. For patients who have oxygenation problems, this 21% oxygen derived from the environment is not enough to sustain his or her need for oxygen in the body. That is why we give oxygen therapy or supplemental oxygen. For the indications we give oxygen or supplemental oxygen to patients who experiences hypoxemia. Hypoxemia means it is a decrease in the arterial oxygen tension in the blood. It simply means that there is a decreased oxygen in the blood. Hypo means low, ox means oxygen, and emia in reference to the blood. So we could say it's decreased or low oxygen in the blood. Also, patients who have hypoxia, okay? So it is a decrease in oxygen supply to the tissues or cells. In your hypoxia, this is in reference to the tissues or cells who experience lack of oxygen or there is an insufficient oxygen. So we call that as hypoxia. Now let's proceed to your types of hypoxia. First, we have your hypoxemic hypoxia. It means it is a decreased oxygen level in the blood resulting in decreased oxygen diffusion into the tissues. We also have called circulatory hypoxia. It is a hypoxia resulting from inadequate capillary circulation. We also have anemic hypoxia. It is a result of decreased effective hemoglobin concentration, which causes a decrease in the oxygen carrying capacity of the blood. Lastly, we have your histotoxic hypoxia. It occurs when a toxic substance, such as cyanide, interferes with the ability of tissues to use available oxygen. So these are the 4 types of hypoxia. Now let's proceed to the complications of administering oxygen therapy. Oxygen is a medication, but administered in emergency cases without prescription. So, for non-emergency case, a prescription from a doctor or physician is needed in order for a nurse to administer oxygen to his or her patient. Too much oxygen may cause toxic effects on the lungs, the central nervous system, and it could actually depress ventilation. Okay, so take note of these, that it is very important that when we administer oxygen to our patient, it should be prescribed by the doctor. For your oxygen toxicity, it may occur when too high concentration of oxygen, approximately 50%, is administered for an extended period, more than 48 hours. Because the oxygen-free radicals can kill and damage cells. That is why we have to use oxygen as prescribed only. Okay? So take note of this. Oxygen should be prescribed by your doctor in order to avoid oxygen toxicity. We also have suppression of ventilation. In COPD, or chronic obstructive pulmonary disease, the drive to breathe is a decrease in blood oxygen. Okay? So if we give too much oxygen to our patient, in COPD patients, the stimulus that drive them to breathe will be diminished. We also have other complications. First is the danger of fire, combustion. Remember that oxygen is one of the elements in order for a fire to develop. So it is very important to make a sign, no smoking, at the door of our patient's room. Okay, if our patient is using oxygen therapy. So it's very important to put this sign at the door of our patient's room. And it can also be a source of bacterial cross-infection. Okay? So remember, in administering oxygen, we are using tubings. Okay? So the nurse should clean the tubings thoroughly so that cross-infection will be avoided. Now let's proceed to the methods of oxygen administration. So we have here the oxygen administration devices. So it is classified as low flow systems. It means it contributes partially to the inspired gas the patients breathe. So expect that the oxygen administration devices under your low flow systems are being used by patients who have a partial condition. That means the patient can still breathe, but it's not enough. So they need some supplemental or help, such as oxygen, in order for them to compensate with their oxygen demand in the body. We also have high flow systems. That means it provides the total inspired air. Okay, so in this devices, or specifically in these oxygen administration devices, the patient could not independently breathe on their own, so they need a total assistance or help. So we use these oxygen administration devices that could deliver a high amount or high concentration of oxygen in order to compensate with the oxygen demand of the body. So let's see, or let's have the devices or the oxygen administration devices under your low flow systems. So for the device, we have your cannula, the nasal cannula. Okay, the suggested flow rate for this, so liters per minute, is 1 to 2. Then the oxygen concentration or oxygen setting that it could give to our patient is between 23 and 30%. Okay, so there are also some type of cannula that could deliver 3 to 5 liters per minute, and the amount of oxygen concentration that it could give to the patient is between 30 and 40%. We also have cannulas that could deliver 6 liters per minute. So the oxygen concentration that it could give to the patient is 42%. We also have your oropharyngeal catheter, which can give a rate of 1 to 6 liters per minute. Okay, so the oxygen concentration that it could give to the patient is between 23 and 42%. We also have your simple face mask, which could give 6 to 8 liters per minute, having a 40 to 60% oxygen concentration. We also have your partial breathing mask. Okay, so it could give 8 to 11 liters per minute with 50 to 75 oxygen concentration. Lastly, we have your non-rebreather mask, which could give 20 liters per minute with concentration of oxygen between 80 and 100%. Okay, so these are your low flow systems. So as what I have mentioned, we will use only these low flow systems for those patients who can still breathe and will need a partial assistance in terms of their oxygen consumption. So this is an example of your nasal cannula. Okay. Also, I have here an example of your simple face mask, your partial rebreather mask. We also have your non-rebreather mask, and we have your Venturi mask. Okay. By the way, your Venturi mask is classified under high flow systems. Okay. So later we will discuss about your Venturi mask. So now let's proceed to your high flow systems. As what I have said, your high flow systems devices will be used for patients who could not really breathe or could not get any amount of oxygen from the atmosphere or from the environment. So that means these devices will give them a total or complete help or aid in terms of their oxygen consumption. So examples are your transtracheal catheter. So the suggested flow rate is 1/4 to 4 liters per minute, and the oxygen concentration that it could give to patient is 60 to 100%. We also have your Venturi mask. Okay, so it could give 4 to 6 liters per minute, and it could have a 24, 26, and 28% concentration. Also, it could give 6 to 8 6 to 8 liters per minute, sorry, with oxygen saturation, or sorry, with oxygen concentration of 30 to 30, 35, and 40%. So as you noticed, in the oxygen setting or oxygen concentration, it is actually a precise value, okay? Because Venturi mask is used if your patient needs an exact amount of oxygen needed by the body, okay? For example, in your COPD, it is very crucial to administer oxygen to the patient. So it is advisable that you use Venturi mask so that you could set precisely the amount of oxygen, thus decreasing the incident or the opportunity to depress the ventilation or oxygen toxicity. Okay, so that's it. So remember that Venturi mask is used if the patient needs an exact or precise amount of oxygen concentration. Next, we have your aerosol mask, which delivers 8 to 10 liters per minute of oxygen with 30 to 100% oxygen concentration. We also have your tracheostomy collar, 8 to 10 liters per minute, delivering 30 to 100% oxygen concentration. We also have your T-piece, which delivers 8 to 10 liters per minute with 30 to 100% of concentration. We also have your face mask or face tent, with 8 to 10 liters per minute, having 30 to 100% oxygen concentration. Okay, so as you notice, in terms of the oxygen setting and oxygen concentration, high flow systems offer a higher oxygen setting. Okay, remember that we are giving this to patients who are unable to breathe, which they could not have, which they don't have the ability to get partial oxygen from the environment. We also have your transtracheal catheter. So this is how it looks like. So this is the transtracheal catheter. The aerosol mask, okay? So this is your aerosol mask. Your tracheostomy collar, okay? So later we'll discuss about tracheostomy. So just to show you how tracheostomy collar looks like. We also have T-piece, okay? T-piece is used when we wean our patients from mechanical ventilator, okay? So later we will also discuss these T-piece, okay? But to show you on how it looks like, so it is called T-piece because it resembles letter T, okay? Now let's proceed to the nursing management of your oxygen therapy. So basically, we have to promote home and community care. So by educating patients about self-care and of course continuing care, okay? So remember that our patients sometimes are discharged at home with oxygen supplements. So very important to educate them about self-care to avoid cross-infection and also for continued care. Now let's proceed to your incentive spirometry or the sustained maximal inspiration. It is a method of deep breathing that provides visual feedback to encourage the patient to inhale slowly and deeply. And it also maximizes lung inflation and reduce atelectasis. So there are two types of your incentive spirometry. First is the volume type incentive spirometry. In the volume type, the tidal volume is set using the manufacturer's instructions. The patient takes a deep breath through the mouthpiece, pauses at peak lung inflation, and then relaxes and exhales. Taking several normal breaths before attempting another with the incentive spirometer helps avoid fatigue. The volume is periodically increased as tolerated. For your flow type incentive spirometry, the volume is not preset. The spirometer contains a number of movable balls that are pushed up by the force of breath and held suspended in the air while the patient inhales. The amount of air inhaled and the flow of the air are estimated by how long and how high the balls are suspended. So this is an example of your incentive spirometer. Okay, so it contains a movable balls, okay, where the patient inhales, okay, then it pushes up by the force of the breath and held suspended in the air. Okay, in this way the patient's collapsed alveoli will be inflated. Okay, we also have the indications on using the incentive spirometer. So it is used after surgery, especially thoracic and abdominal surgery. This is to promote expansion of alveoli and prevent or treat atelectasis. Okay, so you will notice that if your patient has had surgery, after the post-operatively, the doctor will prescribe incentive spirometer. The purpose for that is to promote the expansion of alveoli and for the patient also to prevent atelectasis. Okay, since the patient is bedridden and there will be no activities for the meantime since the patient is in pain. So a very important consideration for this as a preventive measure is to start incentive spirometry exercises or incentive spirometry intervention. For the nursing management, placing the patient in the proper position, sitting or semi-Fowler's position. As much as possible in using this incentive spirometer, the patient should be in sitting or in semi-Fowler's position so that the lungs can expand well. Educating the patient on the technique using the incentive spirometer and setting realistic goals. Okay, so since the patient is not yet on its fully conditioned body, so he might not be able to move the balls inside the spirometer. So you could, as a nurse, you could actually set your goal that for the first 2 days, you would not expect that the balls or the movable balls inside the spirometer will go up immediately. Okay, so you have to inform the patient that it will take time for her or him to do that. Okay, all you have to do is to support the patient and also set realistic goals for the day. Okay, as gradually until the patient can reach the maximum potential or the maximum level of that incentive spirometer. We also have here recording the result of the therapy. So it is very important as a nurse that you have to record all the progress or the updates related to the improvement or the development of your patient in terms of using the incentive spirometer. Then after that, you have to report this to the doctor for re-evaluation. Now let's proceed to your small volume nebulizer therapy, or the mini-nebulizer. It is a handheld apparatus that disperses a moisturizing agents or medication. It is usually air-driven by means of a compressor through connecting tubes. So this is usually done if the patient is taking a pulmonary inhalation, for example, if the patient has asthma. So this is an example of your small volume nebulizer therapy. And the visible mist must be inhaled by the patient. That is a very important consideration, that make sure that the mist must be inhaled by the patient. Next, we have your indications: difficulty in clearing respiratory secretions, reduced vital capacity, unsuccessful trials or trials of simpler and less costly methods. So that means we use this small volume nebulizer or your mini nebulizer when oxygen therapy and other simple and less costly methods are unsuccessful. Diaphragmatic breathing technique prior to administration. This could potentiate the effect of your mini nebulizer. So we have your breathing exercises. First, you have your diaphragmatic breathing. The purpose of this, or the goal, is to use and strengthen the diaphragm during breathing. We also have your pursed lip breathing. It is to prolong exhalation and increase airway pressure during expiration, thus reducing the amount of trapped air and the amount of air resistance. So this is an example of your diaphragmatic breathing. So in inhaling or in your inhalation, the diaphragm contracts downward, so the belly expands. In the exhalation phase, the diaphragm relaxes upward and the abs and intercostal contracts. Okay, so these are the mechanisms between your inhalation and exhalation phase. We also have your pursed lip breathing. First step is to relax your neck and shoulder muscles. Second, breathe in for 2 seconds through your nose. Keep your mouth open. Keeping your mouth closed. Breathing out for 4 seconds through pursed lips. So this is how you perform your pursed lip breathing. So it is very important consideration or breathing technique if the patient has increased amount of carbon dioxide inside the body. So the goal for this breathing exercise is to eliminate excess carbon dioxide from the body. For the nursing management, we need to instruct the patient to breathe through the mouth, taking slow, deep breaths, and then to hold the breath for a few seconds at the end of inspiration. And of course, we have to educate the patient and family regarding this therapy or procedure. Now let's proceed to your chest physiotherapy. The goals of your chest physiotherapy is first to remove bronchial secretions, improve ventilation, lastly, increase the efficiency of the respiratory muscles. It includes postural drainage, chest percussion and vibration, and breathing retraining. For your postural drainage or the segmented bronchial drainage, it allows the force of gravity to assist in the removal of bronchial secretions. And secretions are removed by coughing or suctioning. So as you can see in the picture, it depends on the location of the bronchial secretions as to where the patient will be positioned. So as your reference, you could look at the picture on this slide. For the nursing management, it is usually performed 2 to 4 times daily before meals in order to prevent aspiration, nausea and vomiting, and at bedtime. Prescribe bronchodilators, water or saline given prior to procedure. This helps loosens the secretions from the bronchial structures. Next, we have your chest percussion and vibration. It helps dislodge mucus adhering to the bronchioles and bronchi. For your chest percussion, it is carried out by cupping the hands and lightly striking the chest wall in a rhythmic fashion over the lung segment to be drained. For the vibration, it is the technique of applying manual compression and tremor to the chest wall during the exhalation phase of the respiration. So I have here a picture demonstrating the percussion and vibration. So for pictures A and B, that is for vibration, and for picture C, that is for your percussion. Now let's proceed to the nursing management. Ensures that the patient is comfortable, not wearing restrictive clothing, and has not eaten. Splints any incision and provides pillow for support. Okay, so for example, if your patient has undergone surgery, so you have to splint any incision, and you could provide pillow for support. We also need to administer pain medication prior to procedure, okay? Especially for patients who have undergone surgery. So they might need pain medication before performing this procedure. Nurse must stop if patient conditions worsen, okay? It's very important to assess your patient during the treatment or the procedure. If the patient feels lightheadedness, has unstable vital signs, and the condition worsens, you have to stop the treatment or the procedure. For the breathing retraining, it consists of exercises and breathing practices that are designed to achieve more efficient and controlled ventilation and to decrease the work of breathing. And it is indicated with COPD and dyspnea. For the nursing management, patient breathes slowly and rhythmically in a relaxed manner to exhale completely to empty the lungs. Patient needs to consume adequate dietary intake because it promotes gas exchange and of course it increases energy levels.